Hi, good morning, Edward. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 13th of May 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Edward Morgan.
And, what is your candidate number, please?
My candidate number is 258811507.
Thank you. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are some things you think are challenging about nursing?
I can only imagine some of the challenging things nurses face. One thing I think may be most challenging is handling situations when patients do not want to pursue life-saving efforts, but their families disagree. I also feel if we are not careful to learn about and practice cultural competence, significant challenges could arise due to the cultural diversity within healthcare facilities and among patient populations.
What are some negative effects experienced by nurses, and how do you tackle them?
Some negative effects of long work hours are fatigue, stress, or anxiety. I think that's true of any job or situation that requires a lot of time and effort. I try to combat the negative effects of stress, both personally and professionally, by practicing self-care and relaxation techniques. I also try to spend time with friends and loved ones outside work so I can have a healthy work-life balance.
What is the longest amount of time you worked at one job?
Most of my work experience until now has been after-school or summer jobs. After graduating high school last spring, I worked at a local grocery store. I decided to stay with them as long as possible through nursing school, because they are known to work with college students to accommodate class and clinical schedules.
Have you worked in a supervisory role in any previous job?
I've never worked in a manager or lead supervisor position. I have worked as a crew leader in a few restaurants. Although I didn't have the authority to hire or fire employees or handle disciplinary issues, I helped with schedules and daily assignments.
In your opinion, how important is open communication between team members?
I believe open communication is crucial for team members, no matter what profession one chooses. As a nurse, I understand how I communicate with peers and patients could significantly impact our team functions and how well patients respond to our care.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. your preparation time is over. You can now start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Edward Morgan, one of the nurses working in this community health center. How may I help you today?
Good morning, Marcus. I want to give up smoking, but failed several attempts. So, I want some definitive advice.
I appreciate your willingness to quit smoking. Definitely, we will help you in the process. Before proceeding further, can I have your name and age for the record, please?
My name is Mihiraa, and I am 40 years old.
Hi Mihiraa, to assist you with smoking cessation, I need to know some details. Can I ask you some questions to have a better understanding of your situation?
Sure, you may please.
May I know in detail about your smoking habit?
Well, nurse, I have been smoking around 20 cigarettes per day for 25 years. I smoke by rolling my own cigarettes. Mostly, I smoke every evening, and only a few during the day.
All right, may I know about your previous cessation attempts?
Why not? First of all, I tried to engage in some other activities whenever I felt the urge to smoke. Some pleasant activities, such as calling a friend, watching movies, enjoying some delicious meals, etc., were also tried.
Oh, that's great.
Interestingly, it often acts as a trigger for smoking. Could you please put forward some other methods of smoking cessation for me?
I realize your situation. Surely, I can provide you with some other techniques, which might be quite helpful. Before that, is there any particular reason for smoking cessation?
I know smoking is injurious to health. I decided to quit smoking for my family, as well as for my health.
That's great. Thank you for the valuable information, Mihiraa. The first thing, which I suggest is, a Compix tablet, which is available in pharmacies. It could help you to reduce the craving and block the rewarding effect of cigarettes. How does that sound?
Oh, it seems to be effective.
Yes, of course, it is. The next one I can advise you is nicotine therapy. Use nicotine patches or gum whenever you feel like smoking, which can stay on your body for many hours and can keep you away from craving to smoke. And the gums are chewable, which can give you some sort of pleasure from smoking.
All right.
Alongside, doing hypnosis allows modification of behavior. I would also like to introduce you to online support groups available, which will be of great help and can be accessed at your convenience. Mihiraa, do you have any concerns?
Well, that's great. What about the use of e-cigarettes?
Mihiraa, e-cigarettes are not recommended due to several health risks. I will explain it to you in detail. E-cigarettes can cause nicotine addiction, thus increasing the chance of starting to smoke regular cigarettes later in life. It emits toxic substances and is harmful to health, causing lung damage, cardiovascular diseases like cough, wheezing and asthma, and even cancer.
Oh, I see. Thank you for the information. Now, how can I stick to the non-smoking regimen?
Your question is thoughtful. I appreciate your enthusiasm. The next step is to build a plan. Don't worry, we will build a plan together.
A plan? Can you please explain it?
Yes, of course. The initial step in our plan is to identify the triggers for smoking and try to avoid it to the best.
Okay, I will.
The next and most important thing that you should keep in mind is that there are many rewards and benefits that you can earn by stopping smoking.
Rewards? What does it mean?
Yes, Mihiraa, by quitting smoking, you will get several rewards. Firstly, you can save money spending on cigarettes. Next, you will become healthier and can avoid several health problems. You will also smell nicer.
Yes, that's right.
Mihiraa, now, we will fix a date to give up smoking completely, as this will make you more compelling to stick to the regime.
Okay, nurse, I think your suggestions are more target-oriented for me. I kindly request you arrange a weekly appointment for me until I stop smoking.
I acknowledge your concern. It shows your desire to quit your smoking habit. Definitely, Mihiraa, I can schedule an appointment once every week for you to check on your progress and to make necessary management. Are you happy with that?
Yes, nurse, thank you.
It's my pleasure. Thank you for accepting my suggestions. I wish you all the best to cease your smoking habit.
Thank you, nurse. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.